is healthcare fraught with challenges or opportunities. As I was looking at the industry update, there was a quote here that I thought was very interesting and appropriate for our opening today. And it states, as businesses scramble to adapt to the myriad of changes in healthcare, universities and nonprofit industry organizations are working hard to prepare new healthcare professionals for the reality of practicing and delivering medicine today. And then it goes on in the next section to talk about hot jobs for 2013 and beyond in healthcare. And I thought this was interesting. So some of the opportunities that are cited as being some of the hot jobs in 2013 and beyond. Biopharmaceutical operations professionals, sounds like a business major to me. Innovators with an eye for generics, contract organizations or contract manufacturing organizations, medical device and diagnostics professionals, regulatory and medical affairs experts, clinical specialists, health economics and outcomes experts, multi-site patient care professionals, nursing and patient care leaders, advocacy and policy roles, and then program directors and project managers. And as I thought about the list of professionals, I thought there's an interesting mix of people who obviously would have to have non-traditional medical backgrounds to be a part of delivering the value in these types of jobs. Many of them really are business jobs that many business professionals will have an opportunity to partake in the healthcare industry in 2013 and beyond. So I have the pleasure of introducing our moderator for today, and then he will introduce our panelists, and we'll push off from shore. Our moderator today is Mr. Ralph Donaldson, Jr. He is President and CEO of Prism Health Services, a privately held company based in Atlanta, Georgia, providing consulting and software solutions to the healthcare industry. Mr. Donaldson is co-founder of Wise Connect, a home health software services solution providing remote patient management and advanced analytics for patients, providers, and care teams. Mr. Donaldson began his career at Accenture and spent more than 22 years leading technology strategy and implementation programs across multiple industries, including healthcare, consumer products, cable, and telecommunications. Please join me in welcoming Ralph Donaldson.
It is my pleasure to be here in front of you this evening, and I thank you for guys for coming out to take the time to learn about the business of healthcare. We're going to start by moving the slide one forward, please. What's interesting about the picture is as I give you a little bit of an overview of healthcare, you're going to see a very important component of the healthcare ecosystem beginning to evolve, and that's the patient. The patient is in the center of healthcare. And as I talk to you, you're going to see different types of patients evolve through this slide. Now, the healthcare industry is made up of 5 very important sectors. They work together into an ecosystem. Those sectors can be obvious to those that are part of the healthcare industry, but for those who are new to healthcare, it may not be. I'm going to take a moment to give you the 5 sectors of the healthcare industry as we're going to talk about them tonight. The first is around care delivery. The thing you think about around care delivery, for the most part, are your doctors. They're the nurses, they're the specialists, the surgeons, the people delivering care to you. Care delivery kind of has 2 pieces to it. The piece that the American U.S. healthcare system is most known for is care delivery, where we're working and providing care, diagnosis, and treatment of a patient. But there's also another very important piece to healthcare care delivery, and that's the ongoing continuation of care when you're not physically inside of the hospital or physically receiving treatment from a medical provider. You might be in a long-term care facility, a nursing home, or in some cases, you may just be going through some wellness and prevention acts so that you're taking better care of yourself so that you can avoid being sick in the first place. So the first important segment is care delivery. The second segment is the payers, or the health insurance companies. When you think of health insurance, You think of Blue Cross Blue Shield, you think of Kaiser, you think of Aetna, you think of Cigna, but you also think of Medicare, you also think of Medicaid. And a lot is made of those two institutions that provide a service to our people that are qualified for the service. But the health insurance companies, including our federal government and state government, are very important financiers of healthcare. A lot of us today just think of it as an insurance card and a copay or deductible that we have to pay as part of the service we receive when we deliver care. But there's a lot to that industry. There's a lot to that sector of our industry. And we're going to talk about that tonight. The third sector is around medical research. And being here close to Research Triangle, you guys can appreciate how important research is. Medical research is one of the things that will advance care for our treatment and diagnosis of patients, but it will also help us with new methods, new techniques, new medicines, new approaches to deliver care and improve care, and hopefully put us in a position to not need care because of preventive medicine alternatives that are being evolved. The fourth sector is around health technology, an area that's very exciting and exploding off the market right now. There are a lot of new technologies being used, a lot of innovative ways that technology is being used today in healthcare and around other industries. A lot of the technologies that are underway now are using what's available in a smartphone to help with diagnosis and treatment and care management of patients. You may not be using them today, but they're coming. And there's a plethora of them that are coming out there. And so as our healthcare industry transforms itself, you're going to see technology, specifically mobile health, telehealth, and telemonitoring take a major foothold in how we receive care in the next 5, 10, and 12 years. The last sector is the government sector. The government sector, I'm certain you guys have heard about it, just in terms of paying attention to the elections last year. A lot of information was coming out in terms of what the federal government was doing in terms of health care, be it Obamacare, be it the Affordable Care Act, which is synonymous to Obamacare. But there are other acts that are put forward by our government at the federal level, and also acts that are put forward at the state level to support Medicare and Medicaid. Those are two important aspects of how our care is going to be provided to individuals across the nation that deal with a variety of demographics. Those 5 sectors are very important. They all work together. But the key thing I want you guys to take away, and very important for this audience, is that there's a few things that's very important to you. So if you think about what I'm about to tell you, you're probably saying, what's important? Why is this important to me? Why is this man standing up there telling us some things about healthcare? There's a few things that's important. One is employment opportunities. Healthcare is about to transform itself. It's about to be different than what it looked like 5 years ago, 10 years ago, probably even 2 years ago. And as part of that transformation, we're going to see a desire and a true skill need for people that have talents like yours to be part of healthcare. Yes, we need more doctors. Yes, we need more nurses. Yes, we need more specialists. But we also need operations people. We need marketing people. We need technology people. We need business administration people. We need finance people. The industry is about to change to be something completely different to what it has been. And there is some resistance to change because that's our nature as a human being. We don't like to change. If I asked you guys to get up and go sit somewhere else in this auditorium, you probably wouldn't like that, even though it's a very simple thing to do. People resist change. And the industry is no different. It's going to resist the change. But inevitably, we're going to see a new healthcare system in the United States delivering care to our people in the world. So the first thing I want to for you is employment opportunities. The second thing that's important to you, there's going to be some changes to how you pay for insurance. Yes, changes to how you pay for insurance. Yes, changes to how you pay for insurance. I want you guys to get that. That's a big deal. And it's not just going to be as simple as looking at the health insurance exchange or getting a new card because I work for a company. You're going to have an opportunity to have more clarity, more visibility into what you're paying for when it comes to healthcare. Healthcare is the only industry that you can walk in the door, get care, and not know how much you got charged for it. Think about it. Can you go into a restaurant, get your food, and not know how much it costs? Can you go to the store, Walmart, Neiman Marcus, makes no difference, and not know what it costs? But you can walk into a hospital and get care. Don't know what it costs. You can walk into a private practice and get care. Don't know what it costs. You can walk into a dentist's office and get care. Don't know what it costs. You don't know what the co-payment is. And they'll even tell you sometimes, well, the cash price is this, but the insurance price is that. This is the only industry that has a difference in the consumer knowing what the quality is, what the price is, what the value they're receiving is. The only industry. That's going to change. We're going to start to see that change. The last thing I think is important for you guys to take away from this conversation is something called patient accountability. It's not talked about a lot on Capitol Hill because it's a political hot button. But as we become more intelligent about healthcare, as we become more intelligent about taking care of ourselves as individuals, we're going to become more accountable and responsible for our own well-being and our own health. Now, I know that seems obvious. I know that seems like we want to do things. But if I ask everybody here, did you work out this morning? I'll probably get a mixed answer. If I ask everyone here, did you eat right today? I'll probably get a mixed answer. But those things are simple things, but those are things we're going to have to begin to do to become accountable for our care. Now, here's the even more fun thing. I had an opportunity to talk about transforming healthcare to a pharmacy school in Houston, Texas. And the number one issue that we have with patients that are on a care plan, that have insurance, and have the medicine that can help them according to their doctor's care plan. Number one issue, the patient doesn't take the medicine. They don't take the medicine. I was surprised. They just don't take it. Then I looked around my own family. I asked my mom, hey Mom, did you take your hypertension medication today? She said, no, I didn't. I was feeling pretty good. I didn't take it. Okay. So we don't take it when we feel good. The point I'm making to you guys is that simple things that we don't do and we have control of doing, we need to begin doing. If it's your medication, if it's working out, if it's eating right, if it's paying your share of what your health care costs are, those are accountability measures that we're going to have to take on as part of our new healthcare transformation. So the three takeaways again, there are employment opportunities for us in healthcare. There is going to be changes to how you pay for healthcare in the future. And most importantly, there's going to be patient accountability, things we're going to have to do to take care of our care.
The healthcare industry is going through a major transformation. It actually has to go through a major transformation because it's the current business model that healthcare has today is not sustainable. If you've read anything at all, you know that the current healthcare costs in this country, and the last time they did this, which I think was in 2010, is that healthcare costs represent about 17% of our gross national product. Healthcare is one of those industries in this country that never actually went through historically any type of transformation compared, for instance, to financial services or airline or energy, etc. So when you look at the transformation, KPMG is a global organization, and I have the opportunity to see what other countries are doing from a healthcare perspective. And it's really frightening when you see what other countries have been able to accomplish and the cost of healthcare compared to this country. We did a poll using Harris Interactive, which is the Harris poll, which you probably are all very familiar with. And what we did is we surveyed the top 550 executives in the healthcare industry who represented doctors and medical institutions, hospitals, insurance companies, medical device companies, pharmaceutical, etc. And one of the questions we asked them is, do they think their current business model, the one they have today, is sustainable going forward? And interesting, over 60% said that their current business model only was moderately able to be sustainable. So if it could only be moderately sustainable, then the obvious next question is, what has to happen in order to change the business model that currently exists today? People think that it's really simple to reduce the cost of healthcare. It is probably one of the most complicated industries because of all the various components and parts that make up the industry. But a couple things have to happen in order for healthcare costs and the transformation to take place. The first thing that has to happen is there has to be a total integration between the insurance companies, the hospitals, the physicians, and the pharmaceutical companies. There's this thing called ICD-10, which goes into effect in October of 2014, which is a diagnostic code. So today, if you break your arm and go to a hospital, the code for your broken arm is a broken arm. Under the ICD-10 code, what you'll be able to know is, was it your right arm or your left arm? And to what degree was the break, where was the break, etc. The reason this is important, and by the way, the United States is 10 to 15 years behind the rest of the world. So with this information, what we will be able to do is we will be able to look at all the procedures, we can look at the outcome, we'll be able to look at what was prescribed either in terms of therapy or medication. We will be able to look at the cost. And Ralph was right when he mentioned the fact that nobody in this room, myself included, who's a healthcare person, understands what it costs for them to have a procedure. In fact, with all due respects, a lot of the physicians in hospitals can't even answer that question. And how sad is that, right? So with ICD-10 as the first part, we're now going to have data that says, was this procedure successful? Was it effective? Was it cost effective? And did we get the best results that we want to be able to get? That in itself alone will be one of the driving factors. But what really needs to happen is the insurance companies, the doctors, and the providers must be able to have a totally integrated value chain or supply chain. So everybody in that chain understands what the cost is to deliver the services of healthcare. The sign that was behind us said, the business of healthcare. The problem with the business of healthcare is we're not running healthcare as a business at all. The second thing that's going to happen, and this is the most critical component, is the only data that's available today is claims data. Data that, for instance, insurance companies have that say that they paid this claim. And that claim information is really important because it drives the pricing, it drives the risk analysis, etc. And that data, by the way, comes from claims that are submitted by providers. But wouldn't it be interesting if the provider's revenue cycle system could actually communicate with the insurance company's claims processing system and it was totally integrated back and forth? How important would that be? It doesn't exist today, but it has to happen going in the future. One of the interesting places in the world for healthcare, believe it or not, is not that far from here. It's in Canada. And so we have a Canadian practice. And some of the things they're doing in Canada is really interesting. What they're able to do is they're able to analyze the clinical data that I mentioned earlier. And they can take that data and they can map it back to demographics, they can map it back to social economics, they can map it back to the prescriptions that people have that they've gotten from their pharmacy. And they can create a profile of people within a very specific geographic area. And with that data, they can actually predict what percentage of that geographic area are going to have various diseases or things that are going to create costs or problems for them as a patient. And the final part of this is kind of interesting, and we've been working on this for a while, is that right now today, the system that's in place is a system called fee-for-service. So you go into a doctor, he does a procedure, he puts his claim in to the insurance company, they pay for the service. Nobody questions the quality of that service that was performed or the effective economic value of the outcome. And what's going to happen in healthcare is it's going to change where we will be paying for quality of service rather than quality of service. The insurance companies, for the most part, are willing to compensate the physicians and hospitals for providing quality of care because what they know and what everyone in this room should know is if you provide quality of care, you will reduce your health costs, etc. In fact, one of the criteria is that if a patient is back into the hospital, the insurance companies will pay less for that readmission than they would when they went back for the first time. And I think the physicians and the hospitals will be paid more if there's no readmission whatsoever. So if you're in this room and you're thinking about a career in healthcare, Healthcare is an industry that's about to go through major change. There's opportunities, and we've talked about this earlier, in the whole spectrum of IT and technology. I mean, quite honestly, I have an iPhone, a lot of people in this room have an iPhone. That technology and what we can do with it and how we communicate, quite honestly, at a certain level, is more sophisticated than some of the technologies that exist today in healthcare. So, IT technology is one. The whole area of data analytics is going to be another big area. Third area is going to be this thing called healthcare operations, and how do you change the processes? How do you change how healthcare operates today? And then finally, as a result of the healthcare operations, there's a whole component of change management. How do you retrain the people, and how do you make them be efficient? I've been in the consulting business for close to 30 years. I've gone through many different areas, Y2K, the internet, etc. I never in my career have ever seen the biggest opportunity that exists in healthcare, because the system, frankly, is almost broke, and basically it doesn't work, and it can only go one place, and that's up. And wouldn't it be great to be part of that journey?
There's going to be a transformation in healthcare to give you value. There's going to be more visibility around the value. Now, I do want to go forward on a point you made, Stephen, from a care delivery perspective. When you mentioned the discussion around fee-for-service transition to pay-for-performance. Travis, can you be able to answer this for us in your role with Vital Health? What strategies and hospitals, or excuse me, what strategies will hospitals and physicians' practices employ to address healthcare reform and this whole pay-for-performance?
At the intersection of hospitals and physicians, which should represent this very symbiotic, collegial, collaborative relationship, and sometimes that exists. But largely today we're not there. You know, all due respect to Steve, he has to deal and work in that world every day. Physicians need hospitals because they essentially drive all the acute care in this country. They have access to capital, they have institutional business processes. Hospitals need physicians because 80% of the care in this country is provided in an ambulatory setting. Physicians lead care teams and are accountable for the quality and outcomes of the care. So the inconvenient truth is much what Steve was saying, is that our healthcare delivery system, while it does produce excellent providers, and if you have an acute illness, there's no better place on the planet than the United States to receive treatment. However, overall our care coordination is poor, our outcomes are poor, our access is poor, and the costs are high and unsustainable.
Transformation. Those things around coordinated care. When we say coordinated care, that means if you're leaving the hospital, your care is being coordinated between your primary care provider, the hospital professionals, maybe a home health or family caregiver at home, but there's a coordination of your care. If you're going to a nursing facility or a long-term care facility, there's coordination so that everyone knows what your treatment plan is, what your meds are, those types of things. We would be surprised if we had the facts at our fingertips here about the number of readmissions into hospitals or the number of issues that patients have just because of lack of care coordination. Seems obvious, but it's not. The other thing I would bring up just a little bit here, I want to talk to Satish and ask a question of him from a care delivery perspective. I want you guys to really hear from the folks that deliver care and how they're thinking about changing the industry and how the industry is going to evolve. This is very important to how we're going to evolve healthcare. Satish, in terms of a couple questions that we have for you. The first one, as a healthcare provider, how are the transformational changes in healthcare altering the way you provide care to the patient?
It's about the patient. For my little quadrant, that always is number one. The patient has already started to exert some of that consumer influence with high deductible plans, which some of you in the audience may utilize right now. And what that means is that if you're going to go get a procedure, you're going to, instead of having a $10 or $20 copay where you didn't really care about the cost, you're going to be responsible for X thousands of dollars of the initial care that you will receive through that calendar year or that plan year. So now you have a vested interest in determining what is the value, what is the quality, what is the price There's no really great tool to figure that out and compare that, but those tools are coming. We've seen this here in the Triangle, probably in our practice for the last 5 to 6 years, where as part of my seeing patients, it's part of the discussion. It never was, well, I'm not sure I'm going to do this because I can't pay for it, so I was in the copay. But now it's, well, what is the cost? Because I have to take this out of my high deductible plan, and I'm not sure I'm going to do this right now if I can wait. And then, you know, what is your cost versus someone else's cost? So that is, I think, a very helpful process of patient engagement as consumers. In interventional radiology, where we practice, when you're helping a dialysis patient, when you take care of their problem, if there's something that happens in 90 days of that episode, you don't get reimbursed for that. That's the global billing period. So that is actually already underway, even before the recent healthcare laws have gone through. But that underscores the value that is being addressed, and that I think will continue to be addressed. And hopefully, the third way that our practice has changed, and me interacting with the patient has changed, technology will provide some data and basis by which we can measure quality, value, and reward, hopefully, one day physicians for performing higher quality care, not just ding them for not performing or having a complication which may or may not be related to their surgery or their procedure. It may be related to comorbidities, chronic disease. It may be related to patient engagement and following through the treatment plan. So we have to figure out how to do that. I think the technology piece is very critical in the healthcare field. You hear this from all our panelists, I think, and healthcare changing. The medical records is a good step with meaningful use, which is an incentive program whereby which providers get paid some money over the next 3 years to adopt electronic health records, and that's pushing the adoption. The problem is there's numerous vendors of health care and EHRs that are meaningfully certified. Well, how does that help coordination of care? How are we going to integrate and care for patients over multiple providers if everyone has a system that's a silo and doesn't talk to each other? And that's been our biggest challenge. We in radiology have used a system called PACS, which displays some of the images you see on TV. Whenever you see a medical thing, they always show the picture with the image on the monitor, even if it's unrelated. But that we've been using that for a long time. That's increased our productivity, and we've used RIS, which is the workflow piece to that. But our RIS doesn't talk to other providers and their medical records. So we have to get past that. And I think that technology, ICD-10, EHRs, finding some solutions and ways to integrate those will help us determine how to pay for performance and how to better engage the patient.
We're hearing from the care delivery sector with the comments from Travis and now Satish. This pay-for-performance model and concept, when I've spoken to doctors about it, I get typically a gnashing of teeth. And some of that is because of what Satish mentioned. They're already guaranteeing their work for some period of time. But separate from that, the whole pay-for-performance is about asking that provider who delivers the care to basically make sure you're doing okay for a period of time after that care is delivered. And if there is more care that's necessary, they're not reimbursed for that care. So the question comes, well, what's the patient's responsibility in this? What does the patient have to do when we provide the care to make sure that they do the things they need to do so they don't get themselves in a predicament where they come back and I am penalized as a provider for not giving the care the right way? So there's a lot of gnashing of teeth around this topic. So I'll just tee that up a little bit before I get to the patient view of this discussion. But I want to tee that up a little bit because I think that's going to be one of the things that you're going to see evolve in healthcare. I do know that from a government perspective, patient accountability was not talked about. Probably won't be talked about because this is a political hot button, and I understand why. But I did ask the question to CMS. I have asked the question of HHS, who are federal agencies that deal with healthcare, about patient accountability and how does that change in the future if we're asking the rest of the industry to change.
10 years ago, maybe on the banking side a little bit, not necessarily as in detail as now, but most of you weren't really doing those things, right? No. Okay, shifting for just a second. Talking about accountability. So your health, who do you think is responsible for that? Do you think it's you personally and what you do, what you eat, the medicine you take? Is that, yes? What about your physician or that care team or the hospital? Anybody?
I see some yeses out there.
I see some yeses.
I see some yeses. I saw a couple of no's. We don't know yet.
So what about the combined effort of everybody working together as a team, yet with the individual and the choices that they make every day as the center core of the person accountable? Does that seem pretty realistic or too far-fetched? Right, because is your doctor with you all day, every day, with the choices that you might make, or that extra ice cream cone, or whatever? No. So, the shift in technology you've seen across every other industry, and the shift in accountability is certainly being felt very changed over the last even year, just in what we have to pay out of pocket differently than maybe in years past. So certainly you can already feel trends and things shifting, but in healthcare there's a tremendous opportunity. We have the technology that other industries have used and have made successful. So for example, okay, so everybody I'm sure, or a lot of people submitted their brackets today, right? Show of hands, who went either online and submitted brackets? Okay, a few.
I can't believe that. We're
I can't believe that. We are here.
No bracket.
Yesterday. Sorry, I was late.
Wow.
There's a shot. So, yesterday or today, submitted brackets. Okay. And did anybody happen to see on Facebook or any of these social media channels the mapping of the fan bases for different schools? Did anybody happen to see that really neat map of the U.S.? And it charted out everyone's fan base for the whole NCCU tournament. And then it projected years past and years forward who would win. It was fascinating. Well, so all of that data, driven by social media channels, predicting an individual's behavior based on where they live and how they've done voting in the past, was fascinating. So if you take the ability to Skype with a physician, email with your care team providers, have things real time, right when you need it, on your smartphone, since everybody, the majority of the population has it, and the ability to track and analyze that data and blend it, yet with the one day, hopefully aligned, integrated system that has the clinical data of when you go to the doctor or have care provided. All of that data merged together to then help you make better choices every day and to help that care team that's working with you to actually support your care forward the way it should be, to remind you to take the medicine when you're supposed to take it, and to make those healthy choices, or go do some exercise, get out of the house and go do some walking. So there's a tremendous amount of opportunity with technology and all of the amount of data that we'll be capturing. There's so much data, it's now taking the opportunity to figure out, well, what do we do with all that data? I'm pulling out my phone because today I got PricewaterhouseCoopers. Is anybody familiar with that major organization that does a lot of research? They sent out a pack of information that talks about solving the talent equation in healthcare. And so they asked CEOs and executive teams within hospitals and physician practices. They asked managed care. They asked pharmaceutical and biotech and government. What is the major areas of gap that we need to figure out within healthcare? And it was IT. And specifically, they walked through what sort of roles within IT that each area is focused on. And you would think, of course, it's pretty obvious that in a healthcare environment, you need the people who are going to provide the care, the physicians, the nurses. But you also have to remember, like the title says, it's a business, the business of healthcare. How does a business thrive?
For John, in terms of your view of public health, as you guys might think of public, before I get to the question, public health is a very important aspect of our healthcare ecosystem as well. As you guys might be aware, we have the Center for Disease Control, which handles public health for our nation. But in addition to the CDC, every state has a state agency that focuses on public health. And when we think of population health, we're thinking about ways to better the population's health as a whole, so that we as members in communities, in our local areas, we can do things in a better, healthier way.
For that also, because I see my role is to bring more bright students, and I feel that there are a lot of bright students out here. I feel we need to bring more professionals into that industry. So just to talk about my industry, there are things beyond your control that affect your health. So there are components that are outside of your reach that you cannot control, that my friend Satish here cannot control. So just imagine that you go to your doctor and your doctor says, you know what, I think you should do more exercise, you should walk more. Well, if you live in a community where you don't have sidewalks, how are you going to walk? If your doctor says, well, you know what, I think you need to eat a healthier diet. You need to eat more fruits and vegetables. What happens if you live in a community where you have convenience stores and these convenience stores don't sell fruits and vegetables? What do you do? So certainly I don't think Satish can help, right, Satish? You can't, you can't mandate that the community creates walkways for people to walk. And that's where government, so that's one important role for government agencies, is to develop these policies, procedures, and guidelines to help out. Another piece, another important role for government agencies is to respond to outbreaks. I'm going to answer a question that a lot of my fellow panelists answered at the end, which is, what are the opportunities in health? If an outbreak happens, such as the swine flu, I think everybody remember that we had an outbreak called H1N1 or swine flu. Do you remember that? I think personally, from my veterinary standpoint, and I'm going to go out on a limb and say that it's probably going to be very difficult for elected officials, whether they're Republicans, Democrats, or even Libertarians, to stand up and say, you know what, if there's an outbreak, you have to fend for yourself. The federal government... Well, they did say that. Well, some of them did say that. But I think it's also need to see that we would have elected officials, the majority of them, saying that if there's an outbreak, folks, we're sorry, we're poor. You have to fend for yourself. Or if there is something like a bioterrorism event, like 9/11, or a nuclear accident, for them to say, you know what, folks, we're sorry, we don't have money, you fend for yourself. And again, your individual doctor cannot help you there, and you yourself, you certainly cannot defend yourself against a bioterrorism. Bioterrorism event, something catastrophic, natural event, that's beyond your control. So this is what the public health in those cases. But now with the, imagine now that we have electronic healthcare records. It's not yet there. We have a lot of issues to work out to have the systems communicate with each other. But there's a promise that eventually we will be able to use this system to detect when there's an outbreak. We will be able to use the systems to look at issues such as disease prevalence. The second thing that's happening in healthcare reform is the emphasis on prevention. Now, everyone who has health insurance, I'm pretty sure that part of your plan makes it for you to be able to get an annual physical for free. That's something that comes as a result of government mandate. That now you can get an annual physical exam for free. That's a wellness. That's part of the emphasis on wellness plans. I think the federal government is going to be assisting different stakeholders in terms of developing these best practices when it comes to prevention. And primarily, before federal agencies like CDC, they used to work, they work primarily with stakeholders such as your local, state health government, community-based organizations, national advocacy groups such as National Cancer Institute, American Cancer Society. what I think you're going to see, and it's starting to happen, is those federal agencies, they're working with new players like employers. You know, for example, CDC developed, the CDC issued a contract for someone to help them to look at the best practices for employers in terms of what are the sort of wellness programs that are working for small-sized and medium-sized employers. So that's one aspect.
And this is all about patient satisfaction and quality from the patient's perspective. So Rick, as you go through this answer, think about it in terms of hitting a home run for us. You're the last at batting. So in terms of where we are, think about it in terms of the patient. What about the patient? Is patient satisfaction more important or less important in the future? Are there more opportunities existing in the area of patient-centered care delivery models? Tell us about the patient's view of this, please.
I work with doctors to help them improve the whole concept of patient satisfaction. And with that, we have about 50,000 surveys, patient satisfaction surveys, come through our system every month. And so I really get to see what makes patients happy and what makes patients unhappy. And I wanted to give you two observations about that. First is that patient satisfaction rarely is influenced by whether or not the physician fixed my problem. Instead, it's driven by things like parking, wait time, whether or not the front desk person was nice to me, and a big one that was sort of talked about in this conversation that we've been quite surprised about is whether or not the physician looked me in the eyes during the exam. And what that is referring to is that we have electronic medical records now, so we have physicians coming into the exam room with their laptops and they're doing this, working through that EMR and those drop-down things as they're seeing us as the patient. And so we have found a significant dissatisfaction rate associated with that, and even have found reduced trust associated with physicians that are coming in and having their heads buried in that laptop. The second observation I would share with you is that I don't think the general public is at all prepared for some of the healthcare reform initiatives. I know of clinics that are refunding patients for the cost of their visit if the total length of their visit was over an hour. And I don't mean the wait time, I mean from the time you show up until the time you leave. If it's more than an hour, you get your money back. And so that just sort of makes me wonder and contemplate the vast differences in paradigms between what I see on a day-to-day basis in terms of what patients are thinking. If patients have to wait 15 or 20 minutes, they're really upset. They're going to Facebook and Angie's List and Health Grades and they're saying this place is no good, don't go there. And yet we're talking about things like group doctor visits. And so I think there needs to be some work done to bring that divide together. So what does this mean in terms of opportunity for the future? A quick story about a client of mine that is here in the Triangle area. They are a surgical practice, and that's something important to remember about this. Because they read their patient satisfaction survey reports, they understood that access was a pretty significant dissatisfier for their practice. And I'll give a little hint to anybody in the market, that's a pretty big dissatisfier for any physician practice. So we came up with a plan to open in 2 of their locations an urgent care or walk-in clinic from 9 a.m. to 9 p.m. 7 days a week. And we nailed that access problem. Never saw another issue about that on the patient satisfaction reports. However, we created a new problem. Patient would call up and say, I want to see Dr. Smith, and the lovely person on the other end would say, great, we'll get you in the week after Thursday. And the patient would say, nah, that's okay, and hang up the phone. About an hour later, that patient would show up at the front desk in the walk-in clinic and say, well, my need I felt was a little more urgent than waiting until a week from Thursday. And so there was this big operational dilemma, and the physicians could have taken the easy way out and said, well, that's why nobody else does that. and let's cancel that program. But instead they said, let's listen to what the patients want, and they looked at their management team and us consultants, and they said, find a way to operationalize that. And I tell you that story because I think that's where the opportunity is in healthcare. I think what healthcare needs is are creative, thoughtful, bold leaders that are focused on the patient. I think that healthcare needs disruptive innovators. And I don't think that we need that because healthcare is broken. I just think we need that because healthcare could be a whole lot better than it is.
Generally, competition has something to do with managing the rise in costs. Do you think that developing a competitive nature in the provision, the providing of healthcare would help? If so, how would that work? Otherwise, how can we control or prevent this continuing escalation of providing healthcare?
And I say transparency, I mean, if you look at going into hospital A, going into hospital B or C, and you say you got a broke arm, how much does it cost here, what they're going to do, what's it going to cost there, what's it going to cost there. You don't have that today. If you went to Walmart or Kroger or something like that and bought Tide detergent, you know exactly how much you're paying for it. I think some of that transparency as it comes about will make us smarter consumers on where we're getting our care. What is it costing and what's the quality of it? But the other aspect of that, the other pressure on that, is how the healthcare insurance providers allow us to have certain benefits that occur a year. Because if we have an unlimited credit card or unlimited insurance plan to keep going, then there's no incentive for us to make attention to quality and cost. There's no incentive at all. But I think there's going to be a balance and reckoning of the two, where you will begin to have transparency of the cost of care and the quality of care. But in addition to that, the health insurance providers will give you an opportunity to make the decision on where you're going to have your care provided, where you can make the best decisions for yourself.
Competition is the key to reducing costs. So once health benefit exchanges are operational in all the states, people, and it'll be a small group of people and individuals, will be able to go onto an exchange with complete transparency and select the health plan and coverage that is best suited for them and their family. It'll be a competitive environment, very similar, by the way, to what car insurance is today if you go online to buy car insurance. So that's one component that's really going to drive competition, which is really going to be really important. The other part of it is, until we get to a point where we can actually define the cost of a particular procedure. So if you want to get, for instance, I'm going to use one of our examples here, radiology, and you have a choice of getting it at a hospital like Duke University or getting it from my friend a couple chairs down, and you can see the cost and you know, and they can tell you what the cost is. Until you become a consumer and buy healthcare as a consumer and you understand what this stuff's going to cost you, I think that's going to drive the cost. There's another thing that we need to talk about is that many large corporations that have a very high number of retirees, like AT&T as an example, has 1 million people that they provide health insurance for who are entire employees of AT&T over the years. So what they're looking at is to come up with a program where they're going to give these folks a predetermined amount of money, which is their money to spend to buy health care.
You know, so when you have that kind of cost increase, as a business, what do you do with it? You can pass it on to your customers, but how long can you keep doing that? Or you can pass it on to your employees and say, guys, I'm sorry, our prices have increased, we have to pass it on to you. But you want also your employees to be happy. So I think because the employers are paying so much of that money, the payers, they're going to put pressure on the system to find new ways of doing it. One of the problems with our health insurance system is that the patient, as you mentioned, Mark, is not accountable. So some of the things that you see payers, employers doing is to say, for example, if you're a smoker, you won't pay more. Or they're going to say, we have a wellness program. If you're not going to be involved with a coach with a wellness program, you're going to pay more. So I think the payers are going to put pressure, they're going to find new ways to reduce costs, because it has to happen.
There are tremendous marketing forces in the United States that tell you to eat certain foods that are not good for you. Television itself, there's been a study showing that people that watch more than 6 hours of television have something like an 18% lower life expectancy. television itself forces you to be sedentary and you don't get the exercise. The question I have is, in the future, how do we combat these marketing forces?
The pharmaceutical companies have a different price schedule for the federal government, to the point that was made earlier, than they do for other people. And so part of the problem with healthcare is got to get the pharmaceutical companies from a pure drug perspective to be a lot more competitive in price. And the way that's going to happen is when we can look at a procedure and see what drugs were recommended and whether or not they were effective, regardless of the marketing. And the person who's paying the bill, which is the insurer, says, you know what, brand X costs X, and it's more expensive, and the outcome isn't any better. That's going to drive, to some degree, the cost that you were referring to.
I don't think there's a more exciting topic right now in this country and probably around the world, but certainly in our country than healthcare. And I don't think there is an industry with more opportunities. And I think that came through, hopefully, for you with this panel discussion. I'll place a challenge to the students here. I challenge you to find a way to have a successful career in healthcare. Because if you think about the span of your lifetime, with the changes that are taking place now and the incredible opportunities, you can do a lot of good and you can make a lot of money. If you can address some of these opportunities and challenges in healthcare.
It's always fun talking in front of students. The session we had with the students was great because they asked some really interesting questions. I just hope that they took away the value of this particular group in terms of the real opportunity in healthcare. So there is a terrific opportunity, and I hope they realize that.
The whole food and diet part of it relates to patient responsibility, and if patients have to begin to take responsibility for their own health, and they do in other countries, and it's not just the patient's responsibility, it's government responsibility. So there are food additives and chemicals that we put in our food and on our lawns and all over our environments that are not allowed anywhere else. And so those chemicals create health problems that we then are faced with as a nation to fix.
There is so much transformation and innovation, and the structure of the healthcare business is transforming from a consumer standpoint. So it really gives the students an opportunity to realize that healthcare is, yes, about delivering medicine and delivering care to patients and communities, but it's now even further than that, and it expands the opportunity to really use technology and use innovative design and design thinking to think outside of the box to deliver care where people need it and when they want it.
I want to thank Dean Pekees for the opportunity to come speak today, and the wonderful students that came to listen to us. It's great to see that there are young folks out there with the kind of energy and enthusiasm for healthcare that are interested in what we do, who have a sense of mission and purpose and want to improve the lives and health of our fellow citizens. So I'm glad to be here. It's interesting to hear a lot of different perspectives on healthcare, and all in all, just a wonderful evening.
Well, I think it's a very unique opportunity to blend people from different aspects of healthcare, the business of healthcare providers, people in public health, all talking about how it's changing.
You don't have to be a doctor, you don't have to be a nurse practitioner, you don't have to be a surgeon. There's a lot of opportunities in healthcare. Technology, administration, operations, business, finance, it's all available to you, so take advantage of it and make the best of it.